Hey, this is Dr. Berry. In this quick video, I want to talk to you about a class of medications that could actually be increasing your risk of dementia. Yeah, that's right. There are medications that are prescribed every day by doctors in the United States, in Canada, in the UK, and in Australia that can actually drastically increase your risk of dementia. This is unacceptable. It's something that needs to quickly come to an end and stop. And I'm going to give you this list of medications and what you can do about this today. Now, if you know someone who's older, who is at risk for dementia, who's scared to death of ever having dementia, if someone's had a relative or a loved one who was diagnosed with dementia and it's really destroyed their life, please share this video with them on their social media. Help them understand which medications that is okay to take short term and which medications definitely should not be taken long term. So share this if you know someone like that. Now let's talk about this class of medications, what it's used for, and what you can do to avoid and basically slash your risk of developing dementia. So the class of medications is called the anti-cholinergics. And this is a very old class of medications. It's one of the very first classes of medications that I learned about in medical school. Because they're so old, they kind of start with those and the muscarinics and the anticholinergics, and they've been around for decades. And they have immediate effects. And so the patient can actually feel that something's happening when you give them this medication. And I think that's part of the reason that doctors feel so motivated to prescribe this medication because the last thing a doctor wants to do is prescribe a medication that the patient can't feel and can't tell is helping. And so this class of medication treats many different symptoms, and I'm going to go through some of those in just a few minutes. But there's a new study out that shows, and the quote is a very robust association, a very strong correlation with the higher dose you take, the longer you take these medications, the higher your risk of dementia is in the long run. And so many of these medications were meant to be taken short term. But as is the habit, as is human nature, we get in habits, we get in ruts, both as doctors and as patients. And so what may have been started for you years ago is what the doctor would consider to be at that point a short-term medication for you that would have been completely safe has become a medication that's been mindlessly refilled hundreds of times, both at your fault and at your doctor's fault, because you should never blindly take a medicine daily for years and years without asking your doctor periodically, now wait, should I still be taking this? Do I still need this? Is this still helping me? Are there risks of taking this medication long term? That's your job as a patient because it's your one life, your one body, your one brain that we're talking about here. And if you just blindly take a pill for the next 50 years that someone gave you, you might suffer long-term consequences from that, and that'll at least partly be your fault. So please don't do that. But obviously, more importantly, and more, I think, more at home is that this is the doctor's fault. A doctor, yeah, we're busy. Yeah, we get lazy. Yeah, we're thoughtless sometimes, but that's never an excuse for destroying someone's memory and leading someone to early dementia. And so this class of drugs, which I'm about to go over, you've got to think about every time you prescribe these. If you're a provider, every single refill, do they still need that anticholinergic, or should I wean that down? Should I stop that? Should I change that to something else? Or do they just not need that at all anymore? That's what a provider has to ask him or herself every single time they write that prescription. So the anticholinergics are a very broad class of medications, and then even some medications that are not anticholinergics can still have anticholinergic effect in your body and in your mind. And I'm gonna link. Well, I'm not gonna link. I'm just gonna list these medications from highest anticholinergic activity to lowest anticholinergic activity. Whether they're in that class or not, they still have this effect. And you need to. And I'm not saying in this video that you need to absolutely avoid these medicines at all cost, that you need to never take these medicines ever. That's not what I'm saying. I'm saying these medications can have potentially devastating long-term consequences if they're taken long-term. So your symptoms may be severe enough that it's worth the risk to take these medications long-term. That's a discussion you'll have with your doctor, right? And so, but most of the time when a doctor and a patient has that that discussion, the doctor says, yeah, you probably shouldn't be taking that long term. Let me change that to something else, or let me wean that down, or let's stop that. And so that's the goal of this video, is to help as many people in the world get off this class of medications as a chronic medication as is humanly possible. The anticholinergics can be used to treat insomnia. They can be used to treat anxiety. They can be used to treat muscle spasms. Like if you sprain your back, you can take this class of medications and it'll calm those muscles down. You can use this class of medications to calm down the muscles in your gut. So if you're having gut spasms, if you have ulcerative colitis, Crohn's, irritable bowel, and you have terrible cramping from any of those conditions, these medications help that. If you have bladder spasms, or if you have overactive bladder, or if you have incontinence, these medications will help that. And so even some of these medications can be used to help treat dementia, as odd as that sounds, but I don't think it's a good choice for a long-term medication for most people. And you may have noticed in a lot of these conditions, the overactive gut, overactive bladder, incontinence, anxiety, insomnia, these are conditions of people who are over 40. And so these are the people who are at the highest risk of developing early dementia, whether it's Alzheimer's or some other type of dementia. There are multiple types. And so what we don't want to be doing as doctors, and what you definitely don't want to be doing as the patient, is increasing your risk of a devastating dementia while we're treating some little short-term problem like a muscle spasm. And so again, I'll say, don't stop taking any of these medications if you're taking something on the list below. That's not your job. Your job is to make an appointment with your doctor, go see them and say, hey, this crazy doctor on YouTube said that this medication can increase my risk of dementia. Is that true? And if it is true, then should I keep taking this? Should I wean it down, or should I stop it, or should I change it? What should I do, doctor? That's the conversation I want you to have with your doctor, and then you can get to the bottom of what you need to do. So many times I've seen in my practice somebody transfer to me from another doctor, and they're on a muscle relaxer for their lower back, or they're on a muscle relaxer for their gut, and they've been taking it for years. And I say, why do you take this? And they say, I don't know, my doctor put me on it, a few years back, and I've just been taking it. No, never, never, never do you blindly, thoughtlessly take a medication like that. If you're taking a blood pressure lowering medication, you can put that on overdrive and just keep taking that, right? If you need something for an underactive thyroid, you may be able to put that on mental cruise control and just take that and not have to really rethink that every time you get a prescription. But any other medication, especially a medication that's used to treat just a symptom, like muscle spasm or overactive bladder or anxiety or insomnia, never blindlessly just take those for months and months and years. They can lead to terrible, devastating problems, including dementia. So I'm going to put a list down below of all the medications in this list and whether they have high, medium, or low anticholinergic activity. And even there will be some medications that are not anticholinergics, but that still have anticholinergic activity. Your job is not to stop your medication. Your job is to go talk to your doctor about this medication if you find one of your medications on this list. Now, if you found this video helpful, please consider subscribing to my channel and clicking the little bell right beside the subscribe button. That way, every time I get a bright idea, you'll be one of the very first to know. And if some of my videos have really helped improve your life and improve your health, you can click on my Patreon link down below. You can sign up quickly and you can throw a buck or two my way, and it just gives me more time to make more videos just like this one. This is Dr. Barry. I'll see you next time.